Hi everyone, welcome to another episode of HealthTech with Purpose podcast. Today's guest is Kristen Valdes, accomplished healthcare executive and founder of b.well. With over 2 decades of experience in industry, Kristen is leading the charge inspired by her personal journey as a mother to a child with a significant autoimmune disorder. Her mission driven approach has earned her recognition as a 40 under 40 healthcare innovator. Join us as we delve into her inspiring story and groundbreaking work on our podcast today.
Hi, Kristen. How are you?
Hi, I'm wonderful. Thanks for having me today.
Yeah, a pleasure. In fact, the great work that you're doing at b.well is very impacting, the way care is being provided. So I was really looking forward to this conversation because I always like to host, where the impact is. So
Yeah.
I'm really interested to talk today on this topic. But before we get into that, can you tell a bit about your background and how was your upbringing like? Where did you start it? And so on. Life before b.well.
Life before b.well, yeah. But I've been in healthcare for most of my career. I actually started as a contractor to the Centers for Medicare and Medicaid Services. And then I helped to launch one of the country's first private Medicare Advantage plans. And I'm focused only on the chronically ill senior population. Grew that. And then, like all good health plans, we were acquired by United Healthcare, where I stayed on as an executive for many years. And during the time that I was building Exxon Health and was at United, was also building my family. So I have 3 children. My middle child, Bailey, was born with a very significant autoimmune disease. And even as a healthcare industry expert, I found it impossible to navigate the delivery system on her behalf. It took 7.5 years to get a diagnosis for my daughter. I was the one who found it, and I'm not a clinician. And then she nearly died because 2 EMR systems couldn't talk to each other. And it was a routine, medication for a sinus infection from her pediatrician that contraindicated to a disease that was sitting in a specialist system that I didn't have access to because there was no portal account or access that was granted to me at the time. And at that point, I recognized that there were a couple of converging ideas and themes in my world, both professionally and personal. And that was that we had failed as a healthcare delivery system to give consumers and their families the tools they need to be active in their own healthcare. So I left 10 years ago, my position at United. I launched b.well Connected Health. It's named for my daughter, Bailey. I've called her B since the day she was born, as a way to do just that. And in that same year, I also joined as a board director to an organization called the Caring Alliance, which is a private-public partnership that brings together big tech companies like Apple, Microsoft, Google, Samsung, and brings together big payers and health systems and third-party applications to work with the government, HHS, ONC, and CMS, to create new federal around creation of transparency to consumers in their healthcare, or what we call a shop of their healthcare consumer.
Okay. Wow, that's great. And how far it has achieved its mission as Care Alliance? Like, how do you see that journey?
I will say I'm incredibly proud of the work that the Caring Alliance has done because when you think about federal policy and rules, there have been, in the prior 10 years, over 3.5 dozen different federal rules that have been passed aimed at shoppability and transparency to consumers. And quite frankly, these rules are pretty transformational because for the first time in history, they've dictated the technology standard to be utilized, not just what people have to do to comply. So most notably, after the 21st Century Cures Act were the information blocking and interoperability rules, which in short give all consumers in the U.S. the basic fundamental right to access their healthcare data through any trusted third-party application of their choosing. So it also moved HIPAA data outside of these complex BAA and contractual arrangements and into something that is consumer consented or ownership right of access outside of HIPAA. And so that actually allows consumers to be in charge and in control. And if data holders don't provide consumers with that data, they get financially penalized. So I like to refer to those as, kind of the sentinel effects that changed healthcare forever that nobody really saw coming. And I think it's important to be able to create an innovation ecosystem because, all digital really starts with data. We can't personalize and engage people if you don't know them, and you can't know them without access to their data. Now consumers.
And connecting that data, because if the data is siloed, then again, you're sitting on, let's say, one side of the thing, but not looking what's going on behind, like that.
That's right.
Yeah. So tell us more about b.well. So, we touched upon, but why not you elaborate a bit more about the vision and mission of b.well and, again, the impact that it is creating to you.
Yeah, b.well is a unification platform for consumers. Where we work with businesses and enterprises. So we work with employers, payers, health systems, retail pharmacies, and now big tech with our Samsung announcement. And we help our customers to create a better consumer experience in health. As you know, healthcare is highly fragmented. In fact, it's estimated that a consumer's healthcare information is now sitting in 70 different locations. Yeah. And that fragmentation is growing, right? And so, the fact that we also, in the U.S. healthcare system, we consume healthcare as a family unit, with 86% of healthcare decisions being made by women. And that means that we have those 70 locations times the number of people in our families that we care for. So it's really impossible to manage, right? And I say it all the time, can you pull out your phone and tell me when you're next due for your tetanus booster? No. But imagine doing that for your children, for your spouse, for your parents that are aging in place. When are their medications due? Is there a better price? We don't really have the information at our fingertips to be able to manage healthcare for our families in the way that we want to. And so b.well is a unification platform. I always like to say we do the really unsexy part of healthcare where we re-architect the back end. So we create outside data ability for people to connect their data and consent to share it with whomever they choose. But we provide personalized insights to people on top of that data. So letting them know, like, hey, dad didn't pick up his meds at the pharmacy. And you can then take action as a caregiver and say, hey, dad, why didn't you pick up your meds at the pharmacy? Let me go ahead and get them delivered for you, right? So we can actually, in rates time, have better accountability for the people that we care for from a health perspective. And then we use a concept called federated identity, which is really important in digital. So that somebody, one thing we know about consumers is they don't want to log in to all 70 locations, right? They really want to give somebody a consent and permission to provide value in their healthcare journey. And so we leverage a really advanced identity to make sure that someone is who they say they are. And then we actually leverage all those 70 different systems on their behalf to create one unified experience for them.
Great. Well, that's useful. Like you said, people would not even log into 3 different email IDs.
Yeah.
So forget about 70 different medical systems.
Yeah, we make it too difficult in healthcare to access information.
Yeah. So how has this journey been? Because, healthcare is challenging and, that data being in a siloed format, in different places, in different formats, not talking to each other, for any entrepreneur, even if they have made of steel, it will test their grade. So how has been that journey? Like, how did you started solving this problem, or what kind of hustle did you do to get around the system?
Yeah, actually. Well, one, I don't think there's any getting around in the system. I think in healthcare, you have to be really convicted to drive change and to do it the right way. I would say the Care Alliance is something that without it, I'm not sure a lot of these transformations and changes would have occurred, because you do have to bring people together who are interested in seeing this change, who have the same belief, and you need to work on it. So when, 10 years ago, when we were bringing forward a lot of the rules like information blocking and interop, we had to figure out the operational way that could work in the country, because federal rules just say what it is. They don't say how it's going to happen. And it's a lot of sweat labor. And so, I remember very early days, our team sitting in a room because the Care Alliance said, hey, you guys know the payer space. What fields do we need to put in FHIR as mandatory? And then we sat and defined field by field, definition by definition, why it mattered to consumers. And then we helped work with other members of the Care Alliance to bring it through HL7 validate. We were able to bring FHIR live, but even the little operational details is, okay, so I'm a trusted third-party application. How do I onboard to payers and providers to gain access to these APIs, even once defined? So we wrote and helped me contribute that Care Alliance has now published publicly best practice for trusted third-party onboarding. And that helped us because it meant that we didn't have so much variability as we were onboarding to every payer and every provider. And it helped to standardize the how for people who had never done things before. So I think it's about putting in sweat labor, finding like-minded people, and not going it alone. But I would say don't try to go around a system, especially something as big as healthcare, because you're already dealing with an uphill battle of people who are so set in the way they do things today that they really don't want to see change, because it's easier to keep things the way that they are. And digital transformation's hard. change is hard.
Well,
And we are operating on legacy technology systems that are easily, an entire decade or two behind what today's technology can rate.
Right.
So there's a lot of change that's happening, but I would say don't go it alone. Work with a group of people who are like-minded, and there's a lot of them out there.
Right.
And then put in the time and energy to see that change all the way through.
well, that's important. I mean, it seems so simple, but I think that's a pretty important thought to go going together. Yeah. So, and in fact, that reminds me, a talk from last year. I think the Philips CEO said pretty much the same thing. Like, health is so broken that you cannot, why not all the people in this room try to create partnerships?
Yeah, absolutely.
So, so how did you, tell us more about, building the technology aspect of b.well, and so one is the business side, for example, or the your way into, getting the stakeholders of. Now, let's talk about the b.well technology. So, how does it work? If you could give an overview, like what kind of layers, or what has been your approach in building the technology that connects?
Well, we actually had two, right? Because when we started the business 10 years ago, FHIR didn't exist. And so about 7 years ago, we had a choice to make around, do we build our own FHIR server? Do we buy a server? And it was very immature days from a technology perspective.
This episode of HealthTech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health, where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to HealthTech with Purpose. Make sure to subscribe us on Spotify, Apple, and YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
We've always taken the approach that we need to get healthcare out of proprietary data models, because it's too difficult for data to talk to each other across platforms, across systems. So we've been leaning in very hard to FHIR for the last 7 years. And I think open standards are really key to an appropriate, productive, and fast-moving healthcare environment moving forward. And we've adopted other operational open standards as well, like clinical quality language, or CQL. So I think what's unique is that the industry, every payer and provider, given all the federal rules, they're going to have a re-platforming or an architecture stack that looks like FHIR with CQL moving forward. There's already great programs, like our friends at NCQA, who are starting to receive information through FHIR with CQL, trying to get closer to the bedside. So we're not just chasing information from EMRs and then submitting it through medical claims, but being able to actually take EMR data mapped with medical billing data and be able to submit and using FHIR. We see prior auth, and the new rule that dropped in January, leveraging the Da Vinci implementation guides, and phenomenal work was done there by that organization using FHIR and CQL. So as we think about the interoperable standards, it brings us much, much closer to having systems that can talk with one another, mean the same thing out of multiple EMRs, multiple mirror systems. And so we're very, very big on open standards. And so we've had to take all data, both inside and outside of healthcare. I would say we're probably one of the furthest advanced because we have more endpoints and APIs in FHIR than most organizations, because we go well beyond payer and provider, and think things like surveys, questionnaires, social determinants, all standardized into implementation guides. There are more implementation guides for FHIR than most people recognize. And so we really try to go early, provide feedback, and help our customers get their data into a format where they can share it downstream with other partners as well.
Okay, very interesting. And today, with the b.well ecosystem, like, who are the different players that are, let's say, are there like partners that are building on top of b.well, or are there just the providers and the patient that you're catering to? So how does the one ecosystem deploy?
Well, you used a really key word, which is ecosystem. And I think that we are in a transformational time right now where healthcare, we tried to move into the app economy 7 to 10 years ago, where all of a sudden healthcare was like, wait a minute, digital, we have to catch up, right? There's an app for that. But there really wasn't from a healthcare perspective. That was completely missing. And so we're moving now from an app economy into a platforming strategy. And platforming strategies are still actively being thought through on both the payer and the provider and pharmacist side of things, because there are multiple kinds of platforms. You might have an EMR platform, you might have a population health platform, you might have a consumer-facing platform. But if you're using open standards, these platforms can hook together really nicely and efficiently to move data in a streamed format, because healthcare data that we operate on has been very lagged. And that's why historically, healthcare is even monetized on predictive models based on the past, what's going to happen in the future. Well, now we can actually receive information in real time as we get to more sensors and wearables in the home. We get more real-time survey and digital connectivity with consumers, so we can get more personalized. And we believe that precision healthcare is now absolutely achievable and at a much faster pace every year, because we can get to real-time stream data information and we can get it downstream into systems where it matters most. And that means whether you're at the point of care, standing in front of a doctor, or you're in your home. So when we think about now moving from platforms into ecosystems, this is where the real excitement to me happens in healthcare. So, Walgreens, who is a top customer of b.well, and because of pharmacies, right? But a lot of our providers, they don't have a pharmacy.
Right.
So how do you think about putting apps within apps or experiences inside of others? And so when we think about the power of, if somebody is discharging from a hospital, being able to let them know that their drugs can be available at their local neighborhood Walgreens, they can be delivered directly into the home in a certain period of time, because we have the care plan, we have the medications that have been prescribed, and we can now basically put a pharmacy inside of every payer or provider platform. With Samsung, right? Samsung is a consumer electronics company. They have a ton of capabilities inside the home. They sell a ton of phones. They have 64 million US users from a phone perspective. But what they sell more of than phones is televisions. So imagine a Samsung watch sitting on the couch detecting AFib for the first time, and an alert pop up on your television or on your phone that a local physician is available to see you through their Tylenol free. So we can now take provider services, we can bring them inside of people's homes and their wearables and their devices. And that's actually the definition of meeting people where they are. So the technology has advanced to a point that we can build out these 4 ecosystems, but also parts our providers who are giving bring care, and to get that new wealth and acquisition, and for people to know that there are providers that only innovate better that locally to serve. Sorry about that. Sorry about that.
So, you touched upon the various things. So, what remains as the, unsolved challenge in the journey now?
Well, I think that there's a number of unsolved challenges, right? I mean, I think you can't be at a healthcare conference right now without talking about generative AI and large language models. I think that it's important to think about the use of open standards, because one of the advantages that companies on open standards have is that they're not training against proprietary data models and the entire internet. You can actually, turn the temperatures way down, avoid a lot of hallucinations by training on things that are fully and well documented, that are leveraged across the ecosystem. And so you can actually advance your AI usage a lot more quickly.
Right.
And I think that it's going to be incredibly transformational. I do think that there are still some challenges in healthcare data. There are still some coding systems and mappings that are inconsistent across different, EMR systems, different hospitals. A lot of information is still unstructured. But technology has really advanced to allow us to start to solve those hard problems using advanced AI technologies, which can be deployed a lot faster now. So I think what we're going to see is an acceleration of solving many of those problems, because now we have the basic infrastructure to do that without having to take years to train on something that's not well known, that's proprietary.
Right. And I can foresee the role of b.well, in such a space, because you are already sitting on these connected data, which is kind of the most important thing for AI engine. Like, for any AI engine to work, it would always be like, how good the data is on which you're building that, like any LLM. And I think b.well has that, ready data background that can be a great input to the AI.
But we have a long way to go, because we're still talking about standardizing data that is from an episodic encounter, right? And if you think about the fact that the average American sees their doctor 1.4 times per year, we're doing a whole lot of work on that 1.4 times per year. Now, obviously, there's variability with people with chronic conditions, comparatively to those that are, young, invincible, and healthy, and maybe go 1 time a year, is that, right? And so there is a lot of variability, but the power of being able to pull in real-time data of people's goals and objectives, their lifestyle, their food. Food as medicine is becoming really important. Yeah. But we're still a long way from shoppability. We still exist in a world where our healthcare ecosystem is the only thing we have to interact with, where we're required to receive a service before we know what it's going to cost us. And that has to change. And so, with price transparency and advanced DOB rules and estimations and being able to modify our technologies to give people choice in their care, to give them shoppability, to help them understand that you can fill a specific medication at different pharmacies and it might cost something different. We have to be able to, really convert into shoppability. And so there's a lot of other data environments or data out there surrounding our health that impacts our health that we're not even tapping into. And we're just getting into as an infancy level. And we need to really mature those things because, I always use the example of if I want a red umbrella and I go to Amazon, how many pages of red umbrellas am I going to get? But it's because I can decide what size I want, what color shade I want. Do I want a pattern or do I not? Do I want it delivered to my home? Do I want it part of Prime? What do I want to pay for the umbrella? And that's just a simple umbrella.
Right.
Healthcare is highly, highly complicated where we actually want to know how qualified is my doctor? Does my doctor offer telemedicine? Will they text message with me? Do I want somebody who speaks my language? Do I want somebody who identifies as, LGBTQ? Who is going to match with me on service my needs? Healthcare is very personal. And I think we have to advance historical things like provider directories, which just simply tell you whether somebody is a certain specialty, whether they're accepting new patients, into something that actually matches to what we're trying to feel confident with as we encounter our family's healthcare burdens. And I do think that we have a really big opportunity to start advancing data into information that we need to collect about people to get more personal in that.
Right. Oh, definitely. That's the future because using that AI on the right use cases would be important. So technology, you cannot just fit technology, but you have to, see the problem and solve it with technology.
Absolutely.
So, Kristen, another thing that I would like to touch upon is, as a woman leader in health, since, this is the world where, more and more women, if they come in, they can solve more problems because they come from a space where, like one of the things you mentioned, like 86% decision making in home health is done by women. So we want more and more participation of women in health, especially, on the startups, on executive position. So what has been your learnings, especially as a women executive, that you could share if, other women are listening to this work?
Yeah, absolutely. So, being a solo female founder, obviously, it's been a challenge over the last 10 years, everything from fundraising, to being able to build teams. And I will say that I'm a bit more fortunate than most because I had a lengthy, successful healthcare career prior to launching b.well. And that gave a lot of credibility to the work that I had done. But what I will say is that oftentimes, even today, I'm still the only female in the room. And with healthcare decisions being made by women, we need to get more women involved in health because we experience it on a more deep level than a lot of men and their families. And I think that we need to get really honest about that. We need to also make sure that, as, women coming into healthcare, that whatever business that we're building, it's important to bring a lot of perspective to the table. And so patients need to be included. You need to have patients, you need to have caregivers involved in every single thing that you build. But I would encourage more women to get involved in healthcare because we have a perspective that is unique and we need to continue to build that momentum because we live it every day.
Thank you so much, Kristen, for your time, and it's been a wonderful podcast to me.
Yeah, thank you for having me. Thanks for the conversation.
Thank you for joining us on the HealthTech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.